doctor. So when I got to college, I started studying everything else. I loved philosophy and art history and painting because my mother's a painter. And I started studying everything, and then I kind of came full circle and then ended up becoming a doctor anyway.
Minako, I want to thank you so much for being a part of this podcast this morning.
Oh, thank you so much for having me. It's been an honor, and it has been probably about 30 years since I've seen you. So
that's right, because you were telling me, I taught you when you were in, which grades were you in?
I was still in elementary school.
Elementary school.
When you were teaching at ASIJ.
Right.
And I was a part of your PE. I was one of your PE students, and I took gymnastics for a couple of years. I didn't get past those couple of years because I was terrible at it, but I enjoyed it, and I just love being here with you, and it's just fantastic to reconnect with you.
That's good. It's pleasant to see you as well. Mm-hmm. So swimming was your sport. You preferred swimming?
Yes, I was.
Did you do anything else? Any other sports?
I ran for a little bit, but it was mostly swimming.
Now you're the only child in your family, right?
Yes, I am. Mm-hmm.
What was that like? I mean, did you ever want to have a sister or a brother?
Oh, absolutely.
You did?
Yes. You know, I have a cousin who I'm very close with, and she lived with us for a while. But
right.
Yeah, I always thought it would be nice to have a bigger family.
Now, where were you born?
I was born in Hokkaido. I was born in Sapporo. And I never really lived there, though. By the time I was 6 months old, we had moved to the United States.
Okay.
So, yeah.
When you're 6 months old, you moved.
Mm-hmm.
So how long were you in the United States?
I was in the United States until I was 5. And then I came back to Japan, and then after I graduated from high school, I moved back to the U.S., and I lived there for another 20-some-odd years.
Wait, so your first language was what?
It was English.
Your mother and father both speak English?
Yes, they do. Yeah.
But you're fluent in Japanese as well?
I speak pretty fluently in Japanese,
right.
yes.
And I guess now, working with your father, you have to learn to read and write
yes.
as well, too.
Mm-hmm.
Okay. So, wait, so when you went to this, when you left ASIJ, you graduated in ASIJ,
mm-hmm.
what subjects were you most interested in? Now, you're a doctor now,
mm-hmm.
right?
Yeah.
An MD.
Mm-hmm.
And what were your subjects? What were you?
I loved the sciences, but I also loved literature. So when I went off to college, it was with the intention of becoming a doctor, but...
Is that what you wanted, or did your parents kind of
I think my parents wanted me to be a doctor.
Which one? Both?
Both, yeah. Yeah, mostly my dad, but I think both wanted me to be a doctor. So when I got to college, I started studying everything else. I loved philosophy and art history and painting because my mother's a painter. And I started studying everything, and then I kind of came full circle and then ended up becoming a doctor anyway.
Did you find it difficult at all?
Mm-hmm. The transition back to the United States?
When you went to the States, yeah. Because you had the American school, so it couldn't have been that hard.
Yeah.
Was it hard, though, for you?
I thought so. There was a little bit of culture shock, I would say.
Okay.
And I went to UC Berkeley, so it was a really, really big school.
Right.
So you go from being, a big fish in a little pond to a little fish in this big, huge ocean. But it was a wonderful experience, and I wouldn't trade it for anything.
Did you have any other activities outside of your education that you got involved in when you were in college that you liked?
Yeah, I mean, I was always involved in student government at ASIJ, and so I also continued
What positions did you hold?
I was student council president and class president.
What year was that? Because I wasn't there then. I
don't think you were there anymore. It was 1988 when I graduated.
Okay. So you always had a group around you, huh?
Yeah, I think so.
Okay, that's good. And then when you went to college, you got involved in the same type of things?
Yeah, I did. I was a senator for a while in my college campus, and I still continued swimming and running and things like that.
Did you? So which do you like? Which do you like best, running or swimming?
Swimming.
Swimming better.
Swimming. Absolutely.
And when you swam, were you a competitive swimmer? And which strokes did you swim? What did you do?
My breaststroke was probably my best stroke.
Is that right? Okay. Now let's go into college because we're going to go through this real quick.
Okay.
Because I know you're taking me through there. You were talking about some real interesting things. When did you change after you started studying history and English and everything else? When did you say, okay, now I'm going to really take medicine seriously?
I think it was probably the end of my junior year, so I had one more year to go.
Okay.
And I just came back full circle. I think I was doing a lot of volunteering. I was volunteering in a free clinic for the homeless. And
at that time or prior?
At that time.
Okay.
And I figured, my passion and my mission in life is really to help people. And, what better way to help people than to go into health. So.
What made you decide to go into ER?
I loved being able, like the immediacy of being able to help someone. Someone comes in with a broken bone, you set it immediately, you splint them, and you fix them and they go on their way. Or somebody has a big laceration, you just sew them up. So I loved that sort of immediacy, and being able to help like all sorts of different people from all walks of life. They could come in with anything, and.
But didn't you feel sometimes? I mean, you're in the States.
Yes.
And everyone doesn't come in quite. I mean, they're not as passive or docile as a lot of people in Asia, in Japan.
No, not at all. Not at all.
So didn't you have situations that?
I go crazy. It was crazy. I was in New York City for 15 years. So.
Wait, where were you first? Where did you start practicing first?
New York City.
New York City.
Yes, Manhattan. So yeah, there were plenty of things that are unimaginable here: gunshot wounds, a lot of stabbings, a lot of trauma, a lot of drug and alcohol abuse. So it was a crazy, crazy world.
Now, outside of the music and the commercial breaks, how close is it to like the real series, like ER? Your life there. When you saw, I'm sure you've seen those series.
Oh yeah.
What do you identify with, and what do you call BS on?
I think the drama and the relationships that go on behind the the curtains or whatever. But no, it's as crazy as television, if not crazier. I didn't watch those shows very much when I was in them, because it's like that was my everyday life. It's like I don't want to go home and turn on the TV and watch the same thing. So
right.
Yeah.
What did you find for relief?
Other doctors, friends, people who were not in medicine, reading books. I was into music. So yeah, part of what I liked about ER is like when you're in it, you're fully 100% in it. You're treating people, you're seeing people from all walks of life, but then at the end of the day, after your shift is over, you can have a whole separate life. So it gave me that sort of flexibility between work and the rest of my life.
Did you ever feel threatened?
Yeah, absolutely. There are definitely people who come in who threaten you if they don't get what they want. They come in wanting painkillers or, So.
And what would you do in that situation? How do you handle it?
I made sure a security guard walked out with me when I left my shift.
Did you have to do that often?
Sometimes, yeah.
Wow.
Yeah. And I love working in the ER. I mean, it was very gratifying in some ways, and it could be very frustrating in some ways. And the thing that I realized, though, even though I loved being there and I loved working and loved the immediacy of being able to help people, I realized after a number of years that 80% of what came through my doors could have potentially been prevented.
That's where we're going to go. There you go. Now, how?
Yeah.
How would that be prevented? When did you realize this?
I think it took me about 10 years of working. And you would see the same people coming in, week after week with terrible asthma or heart failure. And between all the, the drug abuse, the traumas, even infections, heart disease, all of these things, 80% of that could have potentially been prevented. So then that started a mind shift with me that, okay, well, we need to treat these patients a little further upstream, right, before they get to that point. And what can we do for that? So I became interested in something called lifestyle medicine. And that's, kind of a brand new field in the United States, and I'm sort of helping to bring those concepts back here to Japan, where, through various lifestyle modifications, and some of the, for the 4 pillars that I always talk about are eat, sleep, move, and relax.
Okay.
So between, good nutrition, sleeping enough, exercising, and relaxation is really about human connections, how you de-stress, how you manage your mind. Like all of these things make a huge impact on your health. And by being able to teach people about these things and having people manage their health in that way, potentially they didn't have to go through that. They potentially didn't have to be in that ER, when I was treating them. So.
Did you start talking to people about this when you came to this realization? About 10 years into it?
No, back then the field wasn't really in existence.
Okay.
And 8 years ago, I had the good fortune of coming back to Japan. And I think that was another mindset shift. And I think that really got me thinking in the path, like even cancer. Right now I work in Tokyo Cancer Clinic, which is my father's cancer clinic, and it's a small clinic and we specialize in immunotherapy and cellular immunotherapy for cancer. And even with cancer, 40% of cancers can be prevented. So, it sort of tied in with my ideas that, a lot of these chronic illnesses can be prevented, and how do we go about doing that? So I did a lot of research on my own, and then after studying it for a few years, I realized there was actually a board of lifestyle medicine. Mm-hmm. So, I studied.
Well, here in Japan?
Actually, no, it's in the United States.
Oh, in the United States, okay.
So
there's nothing like that in Japan yet?
No, we're starting to bring it in. So we have a Society for Lifestyle Medicine here now, and I'm trying to go about and spread the word.
But you're dealing mostly with foreigners now?
Right now, our clinic deals with both foreigners and Japanese. Mm-hmm. And just because of my sort of unique perspective and my years in the United States, actually more years in the U.S. than here, I've been trying to reach out to people in our community, those that speak English and are living in Japan, and mm-hmm. really trying to help them sort of navigate the Japanese medical system, and also sort of teach them what's available to them,
mm-hmm.
that's unique to Japan.
So you're being more of the spokesperson right now, mm-hmm. because as you mentioned at the beginning, mm-hmm. you're licensed in the U.S.,
yes.
but that doesn't apply here.
Right. Mm-hmm.
But can you become licensed? I mean, would it be difficult for you?
I can, yeah. I started down that path.
Okay.
And you have to pass all the Japanese tests, mm-hmm. and then from then you have an oral exam, then you have a written exam, but they have since changed the requirements, and I have to do 2 years of kenshin, which is another residency. And at this stage, I just said, do you
really want to do that again?
Right, yeah. Right.
You can't do it at your father's clinic.
No, I can't.
Okay, it has to be
in a hospital.
Right.
So yeah, and that would take me away from his clinic. My father is 3 years old now.
Oh, is he? Okay.
Still practicing.
Because there's no limit.
Right.
He can be until the end.
Yes, and I think he intends to.
Smart move. Move.
No, and it's it's his passion. It's why he
mm-hmm.
why he does this. So, so in supporting him, it's hard to leave the clinic for 2
mm-hmm.
years. But I figured I could do actually more.
Right.
I can try and spread the word and teach people these are ways to support
mm-hmm.
your health, maintain your health.
Mm-hmm.
I can teach people about cancer immunotherapy, which is what we do in the clinic, and I also run the lab, and I do a lot of research
mm-hmm.
in the field.
So are you speaking at different places?
I'm trying to get the word out there and speak in different places, in different
Such as?
NPOs.
Where have you been able to spread the word so far?
I spoke with TEL,
right,
and we also have our own sort of NPO where we try and spread health information.
Mm-hmm.
And one of the labs that I work with, I did a sort of a talk series for them as well.
Mm-hmm.
So
how's it going so far? I mean, what kind of response are you getting?
Oh, it's good. I think people love it. People love to know that they actually have some agency, right? We all think that we're doomed or destined or
right.
Genetically, it's because of my genetics I end up with cancer, or it's because of my genetics that I have heart disease. Yeah, those things do absolutely, play into it. It is a risk factor, but there's so much that you can change. Mm-hmm. Like even Alzheimer's, you can have the Alzheimer's gene, which gives you a 60% risk of having Alzheimer's, but that means there's 40% of a chance that you can do something
like
so that you don't develop.
Like what? Like what?
So lots of things. A lot of it, starts from education and childhood, how much education you have,
right.
but a lot of it has to do with just healthy lifestyle habits, right? You're eating whole, unprocessed foods, and you're not eating, just junk foods and trans fats, and you're not smoking. My philosophy behind food is, the things that don't have a label are best, right? The things that look like they grow out of the ground.
Isn't that right?
Yeah.
What about eating meat? Do you have anything about that?
Meat, again, in small quantities. Mm-hmm. The Academy of Lifestyle Medicine, they're very vocal about being plant-based. In Japan, I think that's really tough. People like their fish, people like their meat. And especially, you look at all the long-lived longevity communities, there's not a single community that has been completely 100% plant-based.
That's right. That's true.
But I think 90 to 90% of what they eat are vegetables and whole grains. So I think that really is the healthiest way to go. And the more red meat you eat, the higher your chance of things like colon cancer. And also lots of other different types of cancers, and obviously the saturated fats aren't good for you, your cardiovascular system. So the recommendation right now is less than 500 grams of red meat a week.
You said that you were really surprised coming back here after being in the U.S. for so long at how advanced and how good Japan is at treating different ailments as a result of your husband having a tumor on his spine.
Yes.
What was that you found?
So about a year after we moved to Japan, my husband's having these really terrible back pains. We thought, oh, it's probably a herniated disc, but we just thought it was regular back pain. When we finally got the MRI, we found this tumor on his spine, which was terrifying. It was scary. I immediately tried to contact all my colleagues back in the United States.
How long ago was this?
This was 7 years ago now.
So just after you got here, a year after you got here?
It was a year after we got here.
And your kids were how old then?
My kids were 2 and 5.
So I can see what's going through your head. You said, no, you're not going anywhere.
Exactly.
No. That's not going to happen. So what would you do?
Right. So I immediately contacted my colleagues back in the States. Oh my gosh, where should I take him for the best care? Right? Because it was a very rare type of tumor. Once we had the surgery and everything, I was looking it up, and I think there were only 7 cases. You had the surgery here? We ended up having surgery here. Yeah.
Wait, no, I want to get this straight. You said you called your colleagues when you found out that he had it.
I said, where do I take him?
Right, and what did they say?
They all said, stay here.
They all said stay here?
They all said stay here. What? I spoke to neurosurgeons in the States, and they said the technology and the skill and the care that he would get here would have been better than anywhere in the States.
And what'd you say? You said, whoa, go ahead.
I know. I was like, really?
I'm like,
wow.
Because that's not what you were thinking at all.
No.
You just knew it was a trip back to the States. Like to maybe, what's the hospital you're thinking, like, not Walter Reed, there's another one. It's famous for cancer.
Memorial Sloan Kettering.
Yes. So you're thinking something like that, right?
Yeah.
And they told you do not.
They said, no, stay right here. Yeah. We ended up staying here, and he got surgery here, and we had a fantastic, rock star neurosurgeon who took care of him. The whole medical system is so different, though. So that was very strange, right?
How? Tell me how. What are the differences?
Well,
and be explicit so people understand the difference between the two.
Yeah. So in the States, I think it's a lot easier to sort of pick and choose your own doctor. You go and you have this, and communications-wise, I think you have more time.
If you have money.
Yeah, okay, and a lot of that, there's a lot of inequality, unfortunately.
Right, but if you have the money, you're talking about now you're going to compare them with someone that has money and just the average person here, or what?
It's not so much money, but it's insurance. What
kind
of insurance you have?
Well, you have to have money to have insurance.
You have to have money to have insurance. You have to have money to have good insurance, right? And there are unfortunately huge inequities in that.
And here?
And here, everybody is on, national
You have
health.
to. It's national insurance.
Exactly.
Right? And you get the same care.
And you get the same care, absolutely.
And you can pick the hospital you decide to go to.
Yes. But I think it's much more equal here, right, in that respect.
Right.
You can go to any hospital, you can get the same care. So we ended up at Keio University Hospital, and we had terrific care. It was weird because it's like you kind of feel like a cog in a wheel, or like a number. It's like a little number, and then you sit there, and then they call you, and then you go get your X-ray, and then you get called to another area, and then you get your blood work, and then finally you sit down with the doctor, and you have maybe 5 minutes with the doctor.
Okay.
And it seems very unsatisfying, right? But all in all, once they get to know you, they see your care. Oh, and also it's like usually surgery. You say, okay, well, wait in line, your surgery. If it's not an emergency, then we'll take you in 2 months. You're like, 2 months? That seems like a long time. And you kind of have to advocate for yourself, I think, here too.
Did your husband ever get frustrated with that when he was going through and he had to wait with his ticket?
I think so, yeah. I mean, it was because it's very different.
Did you express it to anybody? Did you express it to any of the people there, the nurses or the doctors, his frustration?
I don't think he was that frustrated
Okay,
just
right.
with the system, because he realized, like, even though it's kind of a strange, different way of doing things, it is quite efficient.
Right. Now, does he speak Japanese?
He does not.
Okay,
Yeah.
so were you translating for
Yeah.
him? All right. Did the doctor speak? I would think that they would put someone with him that speaks a little English.
He spoke a little English.
That's what I thought. That's what they're very kind that way. Okay, anyway.
Yeah.
So you went through that, you made it through there, and did you have to wait 2 months or?
They actually ended up having an opening, so they were able to take us in about a month.
Okay.
So, and that all worked out. And, it's just very different. In the United States, they try and make your stay in the hospital as short as possible. Like, I think when I had my babies, we were in the hospital, like a day or two, and they were both C-sections, but here, they actually check you in like a day or two before your actual surgery, and it was very different. It was before COVID, so at least we were able to visit, but you couldn't have kids in to visit.
They didn't allow you in the operation. You didn't come in for the operation.
I was at the hospital for the operation,
But you couldn't be in the room.
No.
Okay. Yeah. So you went through that. You got to be in the hospital when your husband was operated on. How long was the operation?
It was a number of hours, about 5 hours or so.
You stayed there the whole time? Yeah, you said, make sure he comes out of this. He's coming
Yeah,
out.
oh, absolutely. Make sure that everything came out okay.
How were you? Did they know what was going on?
They did. They
Yeah.
did. Yeah.
How were they about it?
They were okay. I don't know. They were kind of young, so I don't know how much they understood.
Did you ever worry? Were you? I'm sure you did your homework on all of it. Now, so what are the risk factors? What could go wrong?
Well, because it was in the lower spine, if there's a big risk of paralysis, not being able to walk again.
Right.
Yeah, absolutely. And it was a very rare type of tumor. I looked it up afterwards, and I think there were only 7 case reports of that particular type of tumor. So, yeah.
And how long did you stay in the hospital?
He stayed for about 10 days, I think.
10 days.
Yeah, and he was let out early because of me. So he wanted to come home, and the doctor said, well, you can watch him at home. So.
When did he start walking? After the operation?
He was able to walk after the operation, like pretty much after a week or so. They got him up and started walking him.
But they wanted to see right away if he could move.
Oh, yeah, absolutely.
Okay,
Yeah.
and he could. There was no problem.
There was no problem. Yeah. So he's doing great, yes.
He's had no problem. It's been 7 years now, right?
Yes,
Almost,
he's been doing great.
Wow.
Yeah.
So tell me, what were your feelings also going through all that? You went through that, and then did you say, maybe Japan has something going on here?
Yeah,
That's right.
absolutely. So Japan has a lot going for it that I think people don't know about. Like, I didn't know about, So it was fantastic. And the clinic where I'm at now, we do something called cancer immunotherapy, which is this fantastic treatment where you're treated with your own cells. So you're your own immune cells. So, you think of cancer treatments.
Your immune cells.
Your immune cells. So the traditional cancer therapies are, surgery, chemotherapy, radiation.
Radiation, right.
And so now, more recently, we have something called immunotherapy. And there are immunotherapy drugs. Immunotherapy is kind of a big, broad term. And there's something called cellular immunotherapy. So what we've specialized in is we take our own cells, our own immune cells, from a blood draw.
From your lymph node?
No, just from a regular blood draw.
Okay, regular blood draw.
Mm-hmm. So from your blood draw, we isolate out immune cells.
Okay.
And we grow them in our lab. So we multiply them to the billions. And we can also train certain types of immune cells to target and fight back against your own cancer. So we create a vaccine.
You can train them?
Yes.
Uh-huh.
Right? We have different types of immune cells in our body,
Okay,
right?
right.
One is called a natural killer cell.
Right.
And these natural killer cells, they know how to target our own cancer cells, right? It knows how to target cells that are infected.
Which all of us have these.
And all of these have them. All of us have them. And so all of these lifestyle things too, right? It's to really boost our immune system and to keep us healthy.
Right.
And so natural killer cells do that. So that's one of our treatments. We take the natural killer cells from our blood draw and grow them out to the billions, and we can retransfuse them into our body to fight against our cancer, right? So that's number one. Those natural killer cells, they naturally know how to fight your cancer cells. And then the other therapy that we have is we create a cancer vaccine. So you were asking about the training, right?
Right, of course.
We have a type of immune cell called a dendritic cell, right? Dendrite means like a tree, like they have these little branches. So these tree-like cells, they actually have the ability to pick up tumor markers in your body, like tumor to cell antigen. So, and from that, when it knows what cells to attack, it will go and talk to the other immune cells in your lymph nodes and create this army of immune cells to be able to target your own cancer. And when we know what type of cancer you have, we can actually feed those targets to these cells. And so then they know, and they get trained, they say, oh, those are the cells, so those are the targets that we have to target. And so we use that and we create a cancer vaccine. So like if somebody has prostate cancer, we can feed it PSA because we know that prostate antigen is high. And different types of cancers have multiple different types of markers on them. So if we know they're a cancer, then we can create a tumor vaccine, a cancer vaccine that's specific for them. So, and what's even more fantastic, and we did this for my husband, when we saved part of his tumor. And we can extract the proteins from that tumor and create a vaccine against that cancer. So God forbid he has this ever again in the future, we can actually create a cancer vaccine against that.
Would the tumor would automatically be the same type of tumor?
If that same tumor had spread somewhere.
Spread somewhere else. But it could be a completely different tumor.
It could be a different tumor.
And then that would have to take a different process.
We've had, in our clinic, we've had about 2,500 patients already. So we've been doing this.
Since when?
We started immunotherapy in 2000. This was before I moved back to the States.
Your father had already started this?
My father had already started this, yeah.
I mean, training the cells to attack and all this, really?
Yeah. So the research started in the year 2000, so 22 years of research already. We started treating patients with the natural killer cells in 2002, and then with a cancer vaccine since 2007.
Okay.
Yeah. Traditionally, the doctor's in the driver's seat, right? And you're driving your passenger, and you're like, no, this is what you're going to do. I'm going to take you and I'm going to drive you to good health.
Right.
But now, being a coach, it's different. You put the patient in the driver's seat, and you're like, I'm just the guide. You're the hero on your own journey, right? But it's like you're training them to use their own minds, to make their own choices, right? But you tell them, science shows that, this is a healthier way to eat. Science shows that you should be exercising this much, or de-stressing, or making human connections and managing your mind. But the position of the doctor is now different. We're the ones who are the guide. We're just the GPS. We're not the drivers anymore. And I think that empowers patients and people. And I think that's the change that needs to go forward. And even if you have a terrible illness or chronic illness or cancer, so you can still live your best life, right? Live, whatever hand you're dealt with, you say, okay, well, what can I control? What can I not control? And then try and control the things that you can.
I like to end my podcast by asking this. What do you consider to be a good life in Japan?
I think wherever you are, to be able to realize your own potential and to keep learning and to keep loving what you do, to find your ikigai, so to speak. I think that's the whole meaning of it all. So wherever you are, and I think being in Japan, we're in this wonderful, safe environment, and certainly there are good things and bad things about living anywhere. And I certainly did not expect for me to come back and to live in Japan, frankly.
Why did you come back?
For family. It's always about family, right?
Okay, right.
So, and...
Daddy called you back?
Yeah, my father needed support, so that's why I'm here. And I love that I'm raising my family here.
Do you?
Yeah.
Because I understand your kids are going to the same school you went to.
Yes, I know. And I think that's wonderful.
How do they feel about it?
They love it.
They do?
Yeah, they love ASIJ. It's I think it's different now. And especially since and especially since COVID, school and everything is just very different. But glad that we're in Japan where it's relatively safe. There's we don't have to worry about drugs and drunk driving and firearms and things like that. So and that they're here and they're learning about the culture and other that they're half of the culture.
Yeah.
So.
That's so good. Minako, I want to thank you so much for taking the time to be here today.
Thank you so much. It's wonderful to reconnect with you.
Really. I want to thank all of you for watching this podcast. Remember, it's all unknown, so continue to reach for the stars because you're too blessed to be stressed.